The latest on the coronavirus, cases top 20,000, first U.S. patient released. Chinese authorities have detected a new outbreak of coronavirus. While this is the same family as the SARS virus, it appears to be a new disease. For the first time in the U.S., a person who contracted the coronavirus has recovered and was sent home. This is a developing story that's been updated since it was first published. Health Tips channel will continue to update in the new video when there's new information. Chinese scientists have identified a previously unknown type of coronavirus as the cause of a recent pneumonia outbreak in the city of Wuhan, according to state media. The current situation follows the severe acute respiratory syndrome coronavirus (SARS-CoV) outbreak in 2002 and the first detection of the Middle East respiratory syndrome coronavirus (MERS-CoV) in 2012. First U.S. patient leaves the hospital, 195 quarantined. The first U.S. person confirmed to be infected with the 2019 novel coronavirus has been discharged from the hospital, according to NBC News. The man, who remains unidentified, has asked for privacy and said, "I am at home and continuing to get better. I appreciate all of the concern expressed by members of the public, and I look forward to returning to my normal life," in a statement. Meanwhile, Dr. Nancy Messonnier, director of the Center for the National Center for Immunization and Respiratory Diseases (NCIRD), confirmed that the CDC has quarantined 195 U.S. citizens evacuated from Wuhan, China, in a telebriefing on January 31. At this moment, CDC staff are speaking with the repatriated individuals in California to let them know that the CDC, under the statutory authority of the HHS Secretary, has issued federal quarantine orders for all 195 passengers. The quarantine will last 14 days from when the plane left Wuhan, China, said Messonnier. The individuals are being held at the March Air Reserve Base in Ontario, California. The military is prepared to offer housing support for up to 1,000 quarantined people in facilities located in California, Colorado, and Texas, according to the Military Times. DoD personnel will not be in direct contact with evacuees, nor will the evacuees have access to the base facilities beyond their housing, confirmed Secretary of Defense Mark T. Esper, Ph.D., in a statement on social media. WHO declares an emergency, first person-to-person transmission in the U.S. The World Health Organization (WHO) announced last week it's declaring a public health emergency of international concern based on the outbreak of the new coronavirus. Dr. Tedros Adhanom Ghebreyesus, WHO Director General, said at a press conference that they were concerned about the virus's ability to spread outside of China. The main reason or the declaration is not because of what is happening but because of what is happening in other continues. The greatest concern is the potential for the virus to spread to countries with weaker systems, that are ill-prepared to deal with it, Ghebreyesus said. Person-to-person transmission has been seen among people in contact with those who have the virus. The full picture of how easily and sustainably this coronavirus spreads is still unclear. Person-to-person transmission can happen on a continuum, with some viruses being highly contagious like measles and others being less so. Deaths due to the virus rose to 500 in China, with more than 20,000 confirmed cases so far in China, according to the New York Times. "This is a very serious public health situation," said Dr. Nancy Messonnier, in an earlier statement. Moving forward, we can expect to see more cases, and more cases mean more potential for person-to-person spread, she said. According to the CDC trusted source, there are another 249 patients under investigation who may have contracted the virus but haven't yet been confirmed. FDA announces new countermeasures against Wuhan virus. The Food and Drug Administration (FDA) will take critical actions to advance countermeasures against the new coronavirus, the administration announced on Monday, January 27. "We have a vital mission to protect and promote public health, and the FDA is closely collaborating with our domestic and international public health partners to mitigate the impact of the novel coronavirus that emerged in Wuhan, China," said FDA Commissioner Stephen M. Hahn, MD, in a statement trusted source. The news comes amid a significant increase in reported infections. Hahn emphasized the FDA will begin employing the full range of the administration's public health employees to facilitate the development and availability of investigational medical products to help address this urgent public health situation. The FDA has also launched a landing page that provides key information for the public, including product developers, on the FDA's efforts in response to this outbreak. This outbreak is affecting healthy and relatively young people as well, according to a recent study published in The Lancet. The researchers also found that most cases may be very mild, facilitating a more rapid transmission of the epidemic. Crucially, only 2/3 of the 41 patients studied had visited the Wuhan seafood market. The most common symptoms at the onset of illness were fever, cough, and muscle pain or fatigue, according to study authors. It is expected that further international exportation of cases may appear in any country. Thus, all countries should be prepared for containment, including active surveillance, early detection, isolation and case management, contact tracing, and prevention of the onward spread of 2019 nCoV infection, and to share full data with WHO, the World Health Organization said in a statement trusted source. On Thursday, January 23, the CDC escalated its health warning regarding travel to Wuhan, China, to a level 3. This report prepare from different news group and media groups. Thank you for watching this video.